When I was pregnant, I felt like everybody was speaking in baby tongue when I was at my prenatal appointments, childbirth preparation classes. I had no idea what so many of the terms meant. I felt really confused. I felt really embarrassed, so embarrassed that I wouldn't simply say, hey, I actually have no idea what you're talking about. Can you tell me what that term means? I would will my mind to be like a steel trap so I could Google all the terms that everybody was talking about afterwards. It didn't work. It wasn't great. My point being, if you, especially if this is your first pregnancy, you have every right to not know what all of the terms mean. This is your first time. Even if it's not your first time, it's like a whole other world, the pregnancy, the childbirth world. So don't be ashamed or embarrassed to speak up and say, can you please tell me more about that test or that term that you're using that I have no idea what it means. But to help you out so you don't have to feel out of your element and really confused, I am going to go through a lot of the terms that some women don't really understand. There's probably going to be some you're like, well, duh, everyone knows what that means, but some women don't. So I'm just going to go through all of them. So active labor. So this is the phase of labor when your cervix dilates from 6 centimeters to 8 centimeters or maybe 9 centimeters. This is when the intensity of labor really picks up. You're rarely able to talk during contractions. If you're going to get an epidural, this is usually when you do it. There's no way to tell you how long active labor will take. It's anyone's guess. So that's active labor. Afterbirth. So afterbirth is the placenta and the membranes that exit the uterus after the birth of the baby. You'll continue to have contractions after the baby emerges. And that is what births the afterbirth. You'll be so distracted, you'll barely feel them. Those contractions are nothing like the contractions you experience during active labor, transition, and the pushing phase. Let's see, amniocentesis. So this is a test that's typically done between weeks 16 and 20 of gestation to test for developmental abnormalities in the fetus. So to perform the test, the care provider inserts a hollow needle into the uterus to retrieve a sample of the amniotic fluid. And they test that to see if the baby has any developmental issues. This is commonly done for women 35 and older. And plenty of women opt out of it, which is totally fine, but I definitely recommend asking your care provider about it, getting lots of information so you can make an informed decision about whether or not you want to do that. Amniotic fluid, this is the protective fluid in the amniotic sac. It's made of water, nutrients, hormones, antibodies that the baby is floating in. So near the end of gestation, the fluid is actually almost entirely composed of baby's urine. And so beyond offering protection, it also supports the development of baby's lungs and their gastrointestinal tract when it's breathed in and swallowed. And it helps to prevent the umbilical cord from being compressed. It provides lubrication, so webbing doesn't occur in areas of the body like the fingers and the toes. It facilitates baby's muscle and bone development because it gives them space to move around. So that is the amniotic fluid in a nutshell. Okay, the APGAR score. So this is a measurement of how baby's handling life outside the womb. So the care provider, they usually perform this evaluation about 1 to 5 minutes after baby comes out, and they rate the baby's color, the heartbeat, reflex, muscle tone, and breathing to create this score, which ranges from 1 to 10, 10 being the ideal number. Birth doula. So this is a woman or a man trained in childbirth who provides emotional, educational, and physiological support before and during birth. So we do not provide any medical assistance. We instead, support the mom in tasks like creating the birth preferences, navigating choices during and after childbirth, utilizing pain and fear releasing techniques. And overall, we, just help mom have a calm and empowered experience. And we often support the birth partner, the birth companion as well. All right, birth preferences. So this is a list of preferences that the mom has for her birth experience. It's often organized by onset of labor, active labor, baby's descent, and preferences for mom and baby after birth. It's usually best to present this document to your care provider around week 36 of gestation to ensure you guys have time to talk about your preferences and make sure you're on the same page. All right, Braxton Hicks contractions. These are like practice contractions that can start as early as 6 weeks of gestation, but they usually aren't felt until the 3rd trimester. They often consist of a tightening and like pulling sensations in the abdomen that are sometimes accompanied by light cramping. So to tell the difference between Braxton Hicks and actual contractions is to get up, drink a cup of water, move around. The hydration and the movement will likely cause the Braxton Hicks to go away, whereas they will do little to minimize the sensations of an actual contraction. All right, Breech Baby. So this is when baby's feet or butt are facing down towards the cervix. Many babies are breeched throughout various phases of gestation, but they tend to turn into the head down position by around 36 weeks gestation. And the baby's head is the heaviest part of their body. So it's pretty natural for them to get into the head down position. I said that usually they turn by 36 weeks, but it is possible for them to turn later. In some cases, something called an ECV, which I'll explain in a moment, will be recommended. And this is the care provider trying to manually turn baby into the head down position by pressing on the exterior of your abdomen. It's not very comfortable, but it can work. While some care providers, a few, not many, will deliver a breech baby, many care providers will recommend a C-section, cesarean birth, if they're not able to get the baby into the head down position. Okay, Cervidil. Cervidil. All right, this is a vaginal insert that is used to help to soften the cervix. It's one of the mildest forms of induction medication, and it's often utilized before something like Cytotec or Pitocin is used. After the insert is placed, likely in a hospital, the mom must remain in bed for 2 hours after insertion, and it's removed after 12 hours or when labor is well established. It's very unlikely that a care provider will recommend Pitocin unless your cervix is showing signs of labor. They want it to be softening, to be dilating. If that's not happening, but the care provider is really thinking that induction needs to happen, they'll likely give you Cervidil first. All right, cervix. So this is the narrow passageway that connects the vagina and the uterus. It's primarily made of fibromuscular tissue, and it must open to 10 centimeters before a baby can be born. All right, cesarean birth. This is just another term for C-section, and it's a surgical birth that consists of an incision through the mom's abdomen and her uterus. The care provider then removes the baby. The incisions are stitched up. During a cesarean birth, most moms receive an epidural, so they're numb from the waist down. There's a curtain at their waist, so they're awake. Sometimes you can feel a bit of pressure, but you should not be able to feel any pain. And hopefully you can ask them to lower the curtain when baby's being removed, and they'll actually do it. That's a neat thing to do, so you can actually see your baby being brought into the world. All right, I'm also going to be creating a video soon about gentle cesarean births. It's a new wonderful trend that has started, so I'll cover that soon. Okay, colic. So this is the phenomenon of a healthy infant frequently crying or being really fussy for prolonged periods. If the baby's going to be colicky, that typically begins around week 6 after they're born, and hopefully resolves by around month 3 or 4. While the exact cause of colic is unknown, some think that digestive issues, food allergies, migraines, or stress can trigger colic. Okay, colostrum. This has been nicknamed liquid gold, and it's the first substance that comes out of a woman's breast after birth. It has like a clear yellowish color, hence the name liquid gold, and it's filled with really high levels of proteins, salts, fats, and vitamins. It's amazing for the baby. Many consider it to be like a superfood for newborns. It helps to boost their immune system. It coats their stomach and intestines to help prevent illness. It acts as a laxative. It can prevent jaundice, and it can lower blood sugar. You'll only actually produce about 1 to 4 teaspoons per day, and it'll be replaced when your milk comes in about like 2 to 5 days after birth. Okay, contraction. You've probably heard this word once or twice. A contraction occurs when the outer vertical muscles in the uterus pull up and then push down. And as they do this, the innermost circular muscles of the uterus, they're pulled up and out, which is what causes the cervix to dilate and efface. So contractions usually intensify and become longer as labor progresses. While this increases the uncomfortable sensations, that's what we want. We want those contractions to get stronger because that's what births the baby. And they will typically occur in steady intervals, and usually the more relaxed you are during contractions, the more effective and less painful they'll be. Okay, cord blood banking. This is a somewhat new phenomenon, and this is the process of collecting the blood from the umbilical cord and placenta after the umbilical cord is cut. They then freeze the blood and store it in a cord blood bank. So some parents elect to do this because the blood contains stem cells that can be used to treat diseases like leukemia, lymphomas, some disorders of the blood and immune system like sickle cell disease and Wiskott-Aldrich syndrome. I might be pronouncing that wrong. So these stem cells, they can benefit the child or their first or second degree relatives. Research is still somewhat new in this, so if you're interested in it, I recommend talking to your care provider about it, doing lots of research before you make the decision because the storage fees can be a bit expensive, but it's something interesting to look into, cord blood banking. Okay, cord prolapse. So this is a very rare but serious complication that involves the umbilical cord dropping through the cervix and into the vagina before the baby. So if you can see the cord, which is not always the case, you need to call 911 and lift your butt into the air to get the pressure of baby's head off the cord. I really recommend asking your care provider about cord prolapse so they can give you very clear instructions on what to do if this happens. But again, it's incredibly rare. All right, crowning. So when the head remains visible and does not retract back into the vagina after pushing, your baby's head is crowning. Some women experience numbness during this phase. I know I did because of nerves being blocked, while some experience like a burning or stinging sensation known as the ring of fire. But honestly, as a doula, most of the women that I've been with during this phase of labor, they're pretty numb, even if they don't have an epidural. Again, because those nerves are being blocked, there's just like so much pressure. So while many women are scared of this phase, it's actually one of the most comfortable phases for some women. Okay, so I'm going to press pause here because this video is getting really long, and I will have part 2 and part 3 of these birth terms defined coming out in the next 2 weeks. So stay tuned.